All right, well, I'm the second speaker, no introduction necessary. Jacques Cohen is my name, and it's a pleasure to talk to you this morning, and I'm really honored that the organizers have invited me, Dr. Kwang, Dr. Kato, and of course, Dr. Zhang. I was given a title about the future lab and the future of medicine, and I thought that that's a good title, but that's a little bit much to cover. So I'm going to focus only on one subject, which is actually data, and it's therefore not the most sexy of subjects, because if you look at the program, there are a lot of nice technological proposals and very interesting work, great talks. And this will not be part of that, because if you look at the literature, you look at data, or literature on data collection and data handling and what you do with it and how you could process it and when you should use it in clinical medicine, particularly assisted reproduction. There's really no guideline. Okay, there are no papers. So I've changed the title in this subtitle here: Assessments and Possible Solutions for the Data Impediment in Art. How can we make it more interesting, and how can we make handle data in such a way that it's useful and usable for the technologies that we are developing and for handling our patients? Okay, and there's a lot of data being produced already. The enormous amount of data produced in medicine and assisted reproduction in general. And there are reasons for that, and I'll show you why that is. Here are my disclosures. For this particular presentation, the only one that I think is of relevance is the first one. I'm involved in a small company, in a startup called LTS Science, and we develop apps for reproductive medicine and other areas of medicine as well as laboratories. And we started this a few years ago. So I do have a potential conflict of interest there. So yeah, a lot of paperwork. Most of that is thrown away in some way. I mean, we may be obligated, depending on the laws and the legal circumstances, to keep paperwork for as long as 15 or 16 years. In India, I think it's 16 or even 20 years. So it really depends on the locality. Data needs to be kept if it's medical information. But that data is not looked at. It's stored away. In other words, it's actually thrown away. It's just kept for a while. Nobody looks at it and nobody processes it. So when we look at paperwork in art, and we look at how much time we spend on paperwork and filling in data, it's estimated to be about 20% of a doctor's time. That is for all doctors in the United States combined. I really don't know how they got this data. I got this off Mr. Google. So I'm not entirely sure that this number is correct, but it sounds about right. And it may be a little higher for our field. Embryology's time, there I have a little bit more data, and I think that's about 30% of their time, where they're handling the processes and the data associated with the processes. Now, why is that? Why is this number so high? Well, increased scrutiny is, of course, one reason. And that is not going to go away. We scrutinize the data, and we scrutinize our outcomes. There's increased oversight, too. Some of that is good, some of that is not so good. Increased oversight of governments, increased oversight of professional organizations in some cases, are very different from country to country. The amount of paperwork in the United States may beat every other country, I think. Our medical practices may not be regulated. Like if you want to do a new technology or you want to apply that in a certain way, that may not be regulated like the HFVA in the UK regulates. But everything else is regulated in great detail. So there's increased oversight. There's also increased curiosity. We just want to know things. And for that, we think we need to have data. And that's correct. But how do you find out things if the processes involved are not keeping up with the time? Electronic medical record keeping systems have been available for at least 20 years, maybe as long as 30 years in some cases. And they are used more and more, and they're not used optimally, and often the systems themselves are a little antiquated. It's estimated to be used in more than 30% of assisted reproduction clinics. But again, there, to obtain data of what the real usage is, it's almost like it's being hidden from you. You can't really find that out so easily. And the EMR practices themselves will not publicize how many clients they have, how many clinics their programs use. So you basically have to find out step by step. So it's hard to say how many clinics in the world really have an EMR system. EMR systems can be pretty sophisticated, depending on the connections that are available. There can be uploads and downloads of data, uploads of results, for instance, in this country to SART and the CDC, downloads of ultrasound data, hormonal data from laboratories. All of these things, connectivities, are being established, and some EMRs, I presume, it's better than others. So the EMR is the nucleus, because it tells you about patients and gametes and embryos. So that's an essential component. But that's not the only area where we produce paperwork. We actually produce a lot more paperwork than is seen in the EMR. There are three streams of data in assisted reproduction, and there may be more than I'm actually telling you this morning. The second stream is enterprise software, and that has to do with running a clinic. And so running a clinic is complicated because it involves staff, not just patients. It involves procedures. It involves systems like inventory. So I'll come back to that a little bit, but I won't spend too much time on it. And then laboratory quality management and quality control, and that's what I want to focus on for the next 10 minutes or so. So there are three ways of handling the data. The first way is the one that's most practiced, and it is just ignore it. Which you just keep filling out the forms, and you keep filling out the paperwork, and then you don't do anything with it. And that's kind of very, very common. Okay, I see it all around me, and I visit a lot of clinics because of my association with reprogenetics, and it's just very common to not do anything with the data. One, I think that is the most common, is that there actually is some system in place, or there are several systems in place, and it's reluctantly embraced by staff. And that's because management and staff usually don't interact about data handling. There's a disconnect here. Data handling is considered a burden by most of us, and that's kind of a pity. We should make it interesting, and so how we're going to do that? So, and then the third way is actually embrace the data. There are different ways of doing it, and there are tremendous advantages. Once you know your data, you know exactly what happens to the procedures and outcomes, and it associates with different variables that you measure. There are advantages. So this is an idiotic diagram, but I made it yesterday evening because I thought, well, why do we want to handle data and look at data? And I think it's because so much is unclear in our field. So if this is assisted reproduction, and each area of it, gene expression may be one box, a huge box, or may consist of several boxes, that area is completely red, okay? Red means we don't know. Gray means that, well, it's a gray area. We know a little bit, but we don't know everything. And then there are a few green boxes where we know quite a bit and think we know everything. So that's the condition now. You probably agree there are probably more red and gray boxes than green. With data, not only with data, but with data and understanding the data and handling the data appropriately and validating the data, you should be able to make these areas more clear. Of course, you can't leave out doing experiments and looking at basic science. Of course, that is prime, but having the right data will make a huge difference in the way of our understanding of assisted reproduction. And so that's what I think, and I think most of you agree, because all of us are handling data and are storing data all the time. So there must be a reason why we're doing that. It can't just be because of an upcoming inspection or an audit. Okay, so just a few examples of our ignorance, because when you look at meeting, you go to AOSRM, you go to actually meetings like this, fantastic talks and fantastic subjects, but the basic grind of the daily work isn't really represented. Pipetting is something my colleagues do 25% of the time. We move embryos and eggs from one place to the next. That's what we do. It's pipetting. I haven't been able to find a paper on pipetting in the literature. And yet, I can assure you that embryologists do this very differently from one another. There are no standards of it. And there's no system of recording it. It could be easily done, but nobody does it. A lot of embryologists think that embryos are ping pong balls, and that they just shoot them from one place to the next. Others are more gentle. What's that difference? Nobody knows. Nobody discusses it, okay? So there are a lot of silly questions like that you can ask, and some of them are listed here, and I won't go into this, but you can make your own list of silly questions, and I could come up with more silly questions than I've put here. They are silly, but they are important. But because they are not very attractive and don't involve major new technologies, they're usually ignored. With data and data assessment, some of that will become more clear. So we do need data, and we do need to understand the data. So the EMR, just a few words about the EMR. The EMR is looked at the patient level. Tracking in assisted reproduction is very different from any other form of medicine because we track multiple individuals. We track usually 2, sometimes 1, usually 2, sometimes 3, sometimes 4. So it's a small population study, very different from conventional medicine. Then there is the temp level and the procedures. Then you get influx of data from other areas that are important for these procedures and attempts. Now, if you look at gametes and embryos, there you also have influx of data. PGD, embryo monitoring, is only going to be more complicated. A lot of data being generated by these new technologies, fairly so, but we need to understand them. In order to understand them, they need to correlate with outcomes. They need to correlate with procedures and embryo dispositions. So most of the EMRs lack flexibility. That is, if you want to add something or remove something or move something, you need to go back to the original coding team, and they will say, yeah, we can customize this, and actually they advertise that you can customize, but truly you cannot. You can't customize. You have to tell them to customize it for you, and that comes at a cost. Also, what's missing is error and missing data detection. And that's doable with people, these EMR designers do not write reports or design reports to actually find errors that you have put in. They do not detect missing data for you necessarily. And it's actually doable. I have been involved in designing EMRs that do that, only those were not for sale. And I hope to actually change that by developing an EMR app called Generations, that will do all that for you, where the flexibility comes from the user. You don't go back to the designer and the coder and ask for them to customize it, because that's extraordinarily time-consuming and expensive. So we will give you a palette in the app where you actually design the fields and the parameters and express the data types. Okay? And you will put those wherever you want, and you can move them around. And so it's first of all, more fun to do, I think, and you can always make changes at any time you want. So you're in control of your own app, and you're in control of your own clinic and EMR. In other words, the EMR will start looking like your clinic, rather than your EMR looking like somebody else's clinic. Okay, so all of it is dependent on user standard operating procedure. You need to have standard operating procedures in order to handle EMRs. Those are usually lacking. EMRs won't tell you how to do it. They probably even haven't thought about it. You really need that, because there needs to be a system of entering data. What do you do at some time when you have to enter some data? Does everybody do that in the same way? And what are the exclusions, and how do you handle exclusions? And for that, you need dedication. So the advantages of EMR, of course, you know. One of the important things is that you can track paper. Tracking paper records will become very, very rare, and you can probably get rid of paper altogether. You can decrease the risk of data loss. And you can have reporting and filtering without an EMR. It would be extraordinarily difficult to do unless you do Excel sheets. And for that, you need staff and, again, a lot of dedication. So now you have search features. You can back up the data. Otherwise, if you lose or misplace a medical report, a medical file, you have no backup, then that's very sad, and that happens a lot. And of course, difficulty with EMR is upgrading them, because with customization comes a certain loss of programming, and upgrading may not be so easy. Now, a few words about enterprise software. Enterprise software comes basically in two flavors: administration and organization. And here are some examples of what that means: purchasing, payments, billing, computer services, security systems, client services, human resources, occupational health and safety. These are the most important examples of what an enterprise system is. This is very, very rarely done in assisted reproduction. So very few clinics have such systems. Only those that are in large hospital systems or in universities may have a system like that. I know of a few in this country, but it is rare. And it involves a high cost if you want to develop it yourself, and will also involve training of staff and keeping them, all the newcomers have to be trained. Every time you hire somebody new, they'll have to be aware of what this takes. So quality management, which is involves an enormous amount of paperwork in the laboratory, is so many aspects of it that when we are audited for IVF laboratories, we basically can fill the whole room with paperwork that the inspector or auditor wants to see. So we keep track of a lot of things. Most of that is on written QC forms. And electronic record keeping, again, is very, very rare. I actually know I haven't found any separate systems, except for one we have developed in the last few years, called an app called Reflections that is available for everybody. The system is really aimed at satisfying the auditing process. It's aimed at satisfying inspectors, whether those are local health authorities or federal health authorities or peer review. It really is made to make that process, and so that you get a certificate at the end that, well, you've done everything, and if there were some issues, you've resolved the citations, and now you're in the clear. So that's what the system is aimed at. It really should also be aimed at analyzing data and understanding what you're doing. For instance, is the pH in one incubator correlated with outcomes? Are these subtle temperature fluctuations correlated with outcomes? Putting a dish on the top of the incubator or instead of putting it on the left bottom of the incubator, does that make a difference? These things we want to know. I mean, we really do. But nobody knows because the data isn't entered, because there are no flexible systems to do it. So fluctuations in instrument performance is usually overlooked. It's always overlooked. It's impossible to keep track of. And so the whole auditing inspection system is a system that goes all the way back to the 1960s and probably earlier. And basically, you take forms, you put them in binders, or you leave them in the folders, and you present that to an inspector. That's how it was done in 1960. That's how it's still done now. And it's kind of a sophisticated way of throwing your data away because you don't analyze things. So you find in the internet, you can find thousands of pictures like this, people with clipboards looking really cool. This thing was invented in 1870, okay, patented. And then patented 4, 5, 6, 7 times again, every time a little tiny feature was added to it, okay, the last time in 1970. So there's nothing cool about this, okay? This is a clipboard, and it's time to get rid of it, okay? It's time to get rid of it. So if you look at outside, you go outside, the moment you leave this room, maybe when you're still in this room, this is what we do. We use handheld devices, maybe not just phones, but it could be a tablet. We use those in order to process everything we're involved in. That should be our work as well. So why is that not our work? And so that's the area I would like you to consider. So we are all technology lovers, and so I think we should embrace these new technologies, and haven't really done that in medicine. Starting to think about it a little bit. Certainly haven't done it in assisted reproduction. So this is the first app we have developed. It's called Reflections, and it's internet-based. All you need is all you need is an internet provider, either an internet provider or Wi-Fi. So like you're sitting here in this room, you could use this app. With this app, you can check the laboratory QC. The app is available for everybody. It's not an IVF app. We advertise it as IVF app because I'm an IVF guy. So you people are the only people I know. I don't know anybody else, okay? So most of our subscribers are IVF people. There are some endocrinologists there, some general laboratories. There's one zoo that is on it in Greece. But we only started this recently and haven't done much, if any, advertising. What you see on the left is basically the dashboard. It tells you about completion. So if you're technicians or embryologists, put in all the data of instruments. They will complete the data depending on the way they want to record data that day or that week or that month. So the entire data recording is so flexible that the app looks like your lab. And whether that's an andrology or an endocrinology lab or an IVF lab, doesn't matter. We do not provide instruments. You have to define that. So when you set up the app, it will take half an hour or an hour, maybe a little longer. You define all the instrument types, all the instruments, all the parameters by which you check those instruments. So what you see here, those are not, when it says dry incubator transfer room and microscope heated stages at the bottom, well, those are not instruments we have provided. You tell the app what you want to look at and what parameters. And you express the parameters in data type. And then later you make lab logs, and you can make as many as you want. These are basically daily or periodic systems you use to check your instruments. Some days you may check everything. Other days everybody may be on vacation and you only check the minimum requirement. And so you can do that with this app. And then the advantages that you can see on the right side, that you can now do reporting. You can look at fluctuations. You can only get completion reports. If you look at fluctuations, you can get summary reports. You can play with the data. You can download it in PDFs, of course, but also in Excel, and then play with the data and do anything you want. Okay, so you see here the top. This is the current layout. The top says today select a plan. The user of this particular plan has selected calling it in series for whatever reason, and the lab log is 100% complete. And then, of course, you can always edit it and change your mind. And you can scroll down. You can access this from your phone, from a pad, or your computer. When you walk around a lab, you probably do that with a phone or a small pad. Okay, now, next year, you can expand on that. It really doesn't take much creativity to expand on something like this and get alerts and updates every day about the status of your lab and maybe even your clinic. So it's quite easy. We're working on an upgrade where within the tolerance limits, so for instance, if you look at the temperature of an incubator, the tolerance levels that you have set for that incubator, there may actually be every day a little shift, a little drift, and that incubator may get warmer and warmer within your tolerance limits, and you don't know it. This is very common. You don't know it. There's actually maybe something wrong. There may also not be something wrong. And so you want to get an alert when that happens, and you should define that algorithm for the app. And so that's going to happen soon. So then you can calculate what the chance of malfunction is. Okay, so we can expand on this. This is in the future, 10 years from now, when you have connectivity and you can connect to all the instruments and these downloads are automatic. Now you need an overview telling you about what the status is and how am I doing. Okay, so I made this up here for this particular purpose. It can check things like inventory automatically, and automatic ordering is active, it says here. So it's likely that if you connect everything, that you have tremendous advantages and don't have to worry about things like inventory. In the lab, like in any surgery, you should never run out of stuff. So as I said before, any internet-connected device should work with apps. How do you connect to instruments? Well, there are smart and there are dumb instruments. Most instruments are dumb. By that I mean they only have analog signals. A microscope, most microscopes are dumb. They only have analog systems, so you can't access them easily. So if you produce an instrument that has a digital signal over analog, it becomes smarter. There are probably several levels of smartness. Does it have a CPU? Does it have multiple CPUs? Does it have an IP address? Can you connect it using an API program, which are these connectivity programs that apps write in order to connect with one another? So the workout programs that you can get on your phone, are dozens of them. The ones that are the best and the strongest are the ones that can connect to instruments, to machines that tell you how you're doing. Okay? So connectivity is important. In the consumer industry, only in the last few years, manufacturers are figuring out that this is very important because of those pictures I showed you. Everybody is looking on that phone. So why not look on your thermostat at home, okay, which is the Nest. You probably know this device. Very useful. You can change your temperature setting at home for any location in the world. Okay, so this is kind of what we need in embryology, where we can remotely access not just dewars, which we are starting to be able to do now, not just some incubators, but look at incubators and look at all the different gas levels, look at the pH, look at volatile organic compounds, to look at all these things and get this connected. Not just incubators, but the entire room, the entire lab, heated stages, refrigerators, etc. And so this is an example of a Korean refrigerator recently on the market that tells you what's inside the refrigerator and whether you should go shopping or not, and what you're missing. What it really should tell you is what's getting spoiled in the fridge, but they're not there yet. I'm sure they will at one point. And they do that now with washing machines, so you can wash remotely. Some people find that probably useful, and maybe it is. So I would like to thank my collaborators on the development of these apps. Here we're working on our EMR app, and this is what we do. We hardly ever meet in person. We do all our meetings online. And so the 6 key people are listed here. Most of these are engineers and coders, and they are in Florida, Arkansas, North Carolina, so they're spread all over the place. And the other 2 that weren't at this meeting are Kelly Catterson, who you know is the operations officer of Reprogenetics, and Alex Bisignano, who is a partner in this, who was the first to write the first code of the first app a few years ago. He's a successful young entrepreneur, probably the most successful in our field, considering his age. And he's involved in this as well. So you can email me. You can email me if you have any questions, or you can go on this website that's listed below. I'm sure other apps will be developed. We already see some patient apps being developed. They're not generic enough. Sometimes you have to use a certain clinic in order to get access to the app, or you have to use a certain EMR system. I apologize for the infomercial.